Hi, my name is Rhonda Gully. I'm a Maryville University student in the F&P program, and today I'm going to be doing my head-to-toe assessment on my volunteer patient here, DP. Thank you for allowing me to do this today. So before we get started, I'm going to wash my hands before I do anything with the patient. And when he first came in and walked into the office, I did a general inspection. I watched the way he ambulated. I looked for any asymmetry. I paid attention to the way he was dressed. He was well groomed. He was very appropriate in his conversation. And prior to him coming to the examination room, I had him to empty his bladder, and he was able to undress for me and put on this gown. He felt more comfortable leaving his shorts on, so he has that on. We took his vital signs. His blood pressure was 120/80, pulse was 80, temperature 8 febrile, 98.2, oxygen was 99%. We did his height and his weight. He's 6'4", and he weighs 145 pounds. I'm sorry, 155 pounds. What was it? Tell me.
240.
240 pounds. Thank you. And we did test his vision with the Snellen chart, and it was 20/20. So we are going to start by doing the head and the face, and always start with inspection. I'm making sure that all the facial and skull structures are symmetrical. There's no lesions, there's no lumps, there's no bumps, nothing like that. I'm also looking at that level of the eyes, and they are even and symmetrical, as well as the level of his ears. So I will also like to go ahead and inspect his hair and just look at the texture, and it's even. There's no thinness or male pattern balding. I'm sorry, I'm just going to set my timer real quick. Meant to do that. And then I'm also feeling the skin, the scalp over the skull, and making sure that it's moving freely. There's no lumps, no bumps. Any pain when I do that?
No.
Okay, great. And so while I'm on the face, I'll go ahead and do some of the cranial nerves. We'll test cranial nerve number 5. Can you clench your teeth for me? Very good. He did that very well. And now we'll do some facial expression. Can you frown? Can you puff your cheeks? Can you smile? Can you wrinkle your forehead? Can you close your eyes very tightly? You did very perfect. Those were the cranial nerves number 7. And then also stick out your tongue for me. Very good. That is cranial nerve number 12. Okay, so the next thing I would like to do is test your temporomandibular joint. Can you open your mouth and close it? Okay, can you move your joint side to side? Okay, I didn't feel any clicking, any pain or discomfort with that?
No.
Okay, very good. And so we'll go ahead and also do the sinuses. We'll do the frontal. Okay, any pain?
No.
Okay, your maxillary. Okay. And then the ethmoid and sphenoid would be in this area, which you're not supposed to be able to palpate that, so that's fine. The next thing we'll do is test some sensations as well. This is still with cranial nerve number 5, so with your eyes closed, very good. We'll do soft, and we'll do sharp, and then we'll do round. So tell me where and how it feels.
My forehead is soft.
Okay, and here?
So my chin is soft. Oh, it's kind of rounded, hard.
And this?
It's sharp on my cheek.
Okay, very good. And then also while we're here, we'll go ahead and do olfactory. Keep your eyes closed, and we'll do one nostril at a time. Tell me what you smell.
Alcohol.
Okay, good.
Alcohol.
Okay, very good. Thank you for doing that. And so the next thing we'll do is look at the eyes. And I'm looking at the external appearance. His eyebrows are nice and even. They're not coarse, sparse, or thin. No signs of thyroid problems. His eyelashes extend outwardly. They look fine. There's no redness, swelling. I can go ahead and palpate the lacriminal apparatus, the glands, the sacs, nasal. Okay. Any pain when I did that?
No.
Okay, very good. Next thing we'll do is we'll start doing some inspection. We're going to do light reflex. I had good restriction there. Good concentric restriction. Then we'll also do the other side. Okay, very good. Very good. Then we'll also go ahead and do cranial nerve number 2 again. And hold this about 14 inches away and read the smallest line for me.
LTFPH.
Okay, very good. And have you covered one eye? Can you read it again?
LTFPH.
Very good. And then go ahead and cover the other eye.
LTFPH. Okay,
very good. And that was 2020. And the next thing we'll do also, I should have had you keep this, is the cover test. Tell me, cover this eye, and I'll cover my eye, and then tell me when you first see my hands.
See it.
Okay.
See it.
Okay.
See it.
Okay, switch eyes.
See it.
Okay.
See it.
Okay.
See it.
Okay, very good. And then we'll test cranial nerves 3, 4, and 6. And we'll do our 6 fields here. Follow my eye and keep your, follow my finger and keep your chin straight. Very good. Very good. Very good. Okay, good accommodation. You did great with that. And so the next thing we'll do is we'll go ahead and we'll move on to the ears, test the hearing, the acoustic nerve, cranial nerve number 8. And I just want to feel the R, look at it, no redness, no tenderness, no draining. Do you feel any pain?
No.
Okay, very good. So, and actually while I have this, I'm sorry I didn't do the red reflex. We'll go back to the eyes real quick. If you could pick a point and stare straight ahead. Okay. Good reflex there. And a good red reflex there. While we have this tool, can inspect the tympanic membrane and the bone structures, pull up and out. Good. It's a nice pearly gray with a nice reflex and visualization of his ear bones, and then I would do the same on the other side. The next thing we're going to do is the Weber and Rhine test. Can you feel it unilaterally?
Yes.
Okay, tell me when it stops.
Stop.
Okay. Okay, tell me when the vibration stops.
Sure. Stop.
Okay.
I hear it. Stop.
Okay, great. And that was a 2-to-1 air to bone conduction like it should. We'll also do the whisper test. Please tell me what I'm saying.
99.
Very good. And we'll do it on this side. I'm sorry, and cover this ear for me.
88.
Okay, very good. That was the whisper test. So we've done head, eyes, ears, nose, throat. We also want to look at the nose. I'm sorry, we'll go to the nose and just inspecting, making sure it's symmetrical. There's no deviations. There's no drainage. I can also look up the nose and just make sure there's no polyps, no deviated septum. Okay, very good. Okay, Then also, as I'm looking at the mouth, I'm looking at around the lips. I'm making sure there's no lesions. They're not dry. They're not cracked. Can you open your mouth for me? All right. Can you stick your tongue out? That's cranial nerve number 12, and making sure there's no deviations or anything like that. We'll test the muscle strength. Can you push your tongue up against my finger here? Very good. And over here. Okay, lift your tongue up for me. And it's very important to inspect underneath the tongue. That's where a lot of oral cancers are. Looking at his teeth and counting them. He has 27 teeth. He's had 4 removed. And then also missing one up front. And he does have fillings that I can observe. Mucosa is nice and pink and moist. And we'll test cranial nerve 9 to 10. Can you say ah? Okay. And gag 9 to 10. Gag is positive, and palate is and the uvula is midline. Can you take a swallow of water for me? And I also noticed there was no hoarseness with his voice, no trouble with that. He's able to swallow just fine. So everything is okay with his mouth. The next thing I want to do is inspect the neck and just look at it, make sure there's no lesions or anything like that. Might as well go ahead and do the lymph nodes here. So the occipital, post-cervical chain, deep cervical chain, superficial cervical chain, supraclavicular lymph nodes, making sure that we don't ever feel anything, because if we palpate that, then that would be a concern for a malignancy. And then we'll just look at his trachea, making sure it's midline. Okay, welcome back. Sorry about that. And actually, while he was taking a break, I did realize that I forgot with the eyes. We would definitely want to look at the sclera and make sure there's no yellowing of the eyes and no jaundice. And we would inspect the conjunctiva, and it's nice and pink. So, all right. Picking up, I believe that we were in the neck area, and we did some lymph nodes. We checked the thyroid. I was able to feel some movement upward, but thyroid was not very palpable, which is a normal finding. So the next thing I would like to do is use the bell of my stethoscope and auscultate to make sure that there are no bruits. I can auscultate the carotids one at a time, making sure not to do 2 and have him pass out. So. Very good. Nice strong pulse. There's no bruise present. Now I should ask you, can you take a deep breath and hold it? Very good. You can let it breathe now. Just auscultating the thyroid. Very good. And also, I'll have you lean back just a little bit more. Get like a 45-degree angle. Would be a lot better if we had a real examination table, but we're just looking for JVD, jugular vein distension. I can actually shine my light from behind to make it a little easier. Okay. Sit up for me, please. There was no jugular vein distension. Doing okay?
Yes, I am.
All right. So while we're up here, we'll just have you do a nice shoulder shrug for me. Okay. Testing cranial nerve number 11. And then if you can resist my hand, turn against it. Okay. He's very strong. And the other side. Okay. No trouble with that. So we'll go ahead and do some more nodes. Do our tonsillar, and our submental. I can't remember if we did pre-auricular, post-auricular, and we're just making sure there's no beads or anything like that. Okay, feels good to me. The next thing we would like to do is to look at the extremities. And I can also do musculoskeletal while I'm doing this. I'm just looking at the arms and making sure he has good muscle tone. Feeling it. Can you squeeze my hands? Very nice, strong grip. Can you not allow me to push your hands down? Very good. And opposite. Okay. He's very strong. And looking at the skin, no skin lesions or suspicious moles or anything. Looking at the capillary refill, looking at his nails, and they have a normal appearance to me. That can give us a lot of information about our respiratory system as well. So you can go ahead and put your arms down. And I think I want to go to the back next. So if you could please hop on up for me. This shirt is a little too short. And I'll just have you turn this way. And I just kind of want to inspect his back. Can you bend over for me? And I'm just looking at the spine. And I can kind of walk up it. Very good. And just looking at his configuration, he has a 2-to-1, no barrel chest or anything like that. And if you can turn, do some thoracic expansion, about the 10th intercostal space. Can you take a deep breath for me? You can see my hands moving. Very good. Do it again. And then also while we're in the back, we can palpate the kidneys, or, I'm sorry, any pain?
No.
Okay. The costovertebral angle? Any pain there?
No.
Okay, very good. The next thing we're going to do is move on to the lungs, and so I inspect his respiration. While we're on the back, I think I kind of want to stay here. Can you say 99 for me? This is tactile fremitus.
99.
Okay.
99.
Okay.
99.
Very good.
99.
All right. The next thing we would like to do is to percuss and just kind of find like a systematic flow. Try not to be in front of the camera. Okay. You can go ahead and sit down. And I'm going to use the same pattern to auscultate that I just used, but just so he's not standing so long. Good. Deep breath for me. Very good. And there's no crackles, no wheezes, no coarseness. And I also want to listen laterally too as well. Okay. Okay. I also want to go ahead and move on to the chest. Is it okay if we remove the top of your gown? Okay. And again, we're just inspecting, looking at the chest, making sure it's symmetrical. And we're also going to percuss. Very good. Can you say 99?
99.
Okay. So we're also going to listen. Deep breath. And then also the diaphragmatic excursion. My tape measure and my little pen. And we'll just do one side for the sake of time. But we will have you, you can put your arms down. We have along the scapular line, have you take a deep breath in and hold it for me. We'll percuss till we hear the sound change. Okay, mark that off. And you can exhale. Go ahead and take a couple of breaths real quick. Then exhale for me and hold it. Alright. Measured that out and I got the number 5. So that's normal. 3 to 7. Okay. So the next thing I want to do is move on to the cardiovascular system. I already palpated. I didn't feel any thrills or anything like that. Also, okay, no heaves, no lifts, no thrills, and that would indicate some valvular stenosis. If I felt any thrills or observed or felt any heaves or pulsations, would be some type of ventricular hypertrophy. So the next thing I would like to do is go ahead and move on to listening to the lung. I'm sorry, to the heart. Is it to our aortic, right second intercostal space. Then our pulmonic, left second intercostal space. And then our Erb's point, third left intercostal space. Then our tricuspid, left fourth intercostal space. And midclavicular line, fifth intercostal space. Point of maximum impulse. And that can also be felt. The next thing I want to do is to move on to our abdominal exam. If you could please lay back for me. And I'm just going to scoot this up to extend our table because he's pretty tall. And I just want to inspect the abdomen and make sure that I don't see any obvious bulges or discoloration of the skin or anything like that. The next thing I want to do is auscultate the 4 quadrants and make sure I hear vowel sounds. And you do this for 30 seconds. If you don't hear anything, then you could auscultate for up to 5 minutes. And he had good vowel sounds. They weren't hyper or hypoactive. Okay, sorry about that. We're back again. What I'm finding is that our camera will only record for 12 minutes. So then it stops and I have to push start again. And backtracking, I should have auscultated for the abdominal aorta with the bell of my stethoscope. Then the renal arteries. Then the iliac. And then the femoral. Which I did not hear anything. That's a normal finding. Okay. And then for the percussion. Okay. Especially on this side, on the right. Looking for his liver border. Then also over here, tympani over the stomach. Then we will also, actually, I'm going to come on this side and see if we feel the liver or gallbladder. Can you take a deep breath for me? Alright, there. There was no pain, no Murphy sign. And also try and feel for the kidneys pushing up, pushing inward at the same time. Then on this side we'll come by, make sure we can't feel the spleen. And also, neither can I feel the kidneys. Very good. Alright, that concludes the abdominal exam. Can you sit up for me?
Sure.
And I can also see that he has good muscle tone when he sits up. Okay. So the next thing I want to do is to inspect the legs, looking at the muscle tone. Can you push up against resistance? Can you pull down? Okay, very good. Also looking at the color, checking the temperature to making sure it's the same bilaterally. There's no swelling, no tightness, no redness, no shininess, even distribution of hair. And then we can also go ahead and check for his pulses. Dorsopedis, post-tibial. Very good. And the popliteal. Excellent. We'll do the same over here. Very good. Very good. Now I believe all that is left for us to do is to check our reflexes here. I'm sorry for expression. Just relax. Sorry. Okay, very good. And then we also have reflexes here. It's kind of hard for me to elicit those. And then we want to do the popliteal. And we want to do the Achilles. Very good. Oops, I'm sorry. Feels funny, huh? Mm-hmm. Okay. Then if I wanted to further assess his muscle strength, I could have him stand up and do squats and all of that stuff, but for the sake of time, we won't be doing that. So that concludes my video. Thank you for watching. Thank you for